we see that the word client and patient, clinicians are often used in abnormal psychology. Now, how do we define who is a client? A client is anyone who is a person who's coming in for treatment and is looking at some kind of collaborated efforts from the doctor, from the psychologist along with him. We generally don't call the client patient, because the word patient in an English dictionary would also have a connotation to being passive, whereas in abnormal psychology we believe that if you're looking at an intervention with a client, the client needs to be as active in the sessions as much as the therapist or clinician. Who do we call a clinician? Anyone who's qualified, who can provide treatment, who can help understanding or training or creating a better orientation for the mentally sick people. It would be called a clinician. Now, the diagnostic process that we're going to be looking at focuses on two things. So whichever diagnostic process we pick up, we need to make sure that all the manuals and the treatments are reliable and valid. I'm sure all of us understand what is reliable. When I say reliable, I basically mean that the test results should be more or less similar over a period of time. And obviously valid would mean that the test that you pick up should be a valid test, because it should study what it purports to say it studies. Now, in the past we've gone through several revisions, and we were using the DSM-4, and then we were moved on to the DSM-4-TR, which was a multi-axial system. Presently we are using the DSM-5 for it's a manual, it's a statistical manual which has a basically medical model attached to it, and it focuses on also understanding different mental disorders, and it is a very strong diagnostic manual. Now, the DSM-5 is definitely different from DSM-4R, and we can see the difference that we've put down in this particular slide, how DSM-5 has some additional information that was not there in the DSM-4R. Now, if a particular illness is not certified in DSM-5, clinicians can also refer to the ISD, which is also a very common manual which is used. Now, when I'm looking at certain behaviors, I can also look at certain behavior patterns which exist only with a particular culture. It exists within a particular culture. So we would call this a culture bound syndrome. And if you can see the list given down, it says that these are the culture bound symptoms or diseases which we will see in particular cultures.